on the Munroe-Meyer YouTube page at that address, and we will also send that link out following tonight's presentation with the slides. So you'll have that information. You can access past presentations there. If you have any questions, I know our presenters always love lots of questions. So if you have any questions, feel free to submit them through the Q&A function, and we will get those to Gina. And at the end of the presentation, there's a very, very, very short, I promise. It's like, I think we added 2 questions, so it might be up to 5 questions now. Survey just to see how it went, if you learned anything, if there's anything else that you'd like to know about. So we would very much appreciate it if you would complete that survey. I believe it should pop up after you log off, or log out of the meeting. So we would appreciate that. Again, Chrissy and I are parent resource coordinators, which again, that means that we are just parents of children with disabilities or special needs who have had specialized training to be able to provide that parent-to-parent support and to help families get connected to different resources like the Early Development Network or Early Intervention Services. We can help navigate medical and educational systems, and then provide different community resources. Some parent resource coordinators are housed in clinics, and we help those clinics meet the social determinants of health, which are kind of those wraparound services or the non-medical needs that can impact families. And as a parent resource coordinator, we are those community health workers with lived experience. The Family Care Enhancement Program that we work for is a statewide program, meaning we have parent resource coordinators throughout the state. These are the different locations that we currently have parent resource coordinators in. So hopefully wherever you're joining us from, there is somebody in your area that knows that specific, the local ins and outs. So we can get you connected to one of those if you would like. We also are excited to announce a few upcoming webinars. In beginning of December, we have Medicaid 101. And the end of January, we have Understanding the Managed Care Organizations. So those are the companies that our Medicaid is through. So you can scan those quick. Otherwise, we will have the links also provided in that follow-up email. So try and make it as easy as possible. How to connect with us. We do have a phone line that is a general intake number, so you can call us on that. The same with the email address there. You can also scan the QR code. That is our physical address, the Munroe-Meyer Institute address. And then we also have a Facebook group that's called MMI Caregivers Corner to help parents and caregivers connect on that level through social media also. So pretty much any way you want to get a hold of us, there is an avenue to do that. So please reach out. We'd love to help you. Again, we are very excited about tonight's presentation and love to welcome Gina Ragland from AARP to provide more information on the caregiver tax credit. So I will hand it over to Gina. Stop share. Okay, Gina, it should be all yours. Thank you again so much for joining us.
Thank you, Jennifer and Chrissy. And I'm gonna make sure I bring up the right. Can you guys see my screen okay?
Yes, it looks good.
All right, perfect. So I have lots of slides. Whoops, I'm starting to share already. Before we start, I guess I want to first take the opportunity to thank again Jennifer and Chrissy for having me and inviting me here. Most importantly, thank you for everyone that's joining us tonight, or if anyone's watching the recording. First and foremost, I'd like to also thank you for allowing AARP to be part of this program. Many people are probably shaking their heads and saying, AARP, children, how does that work and vibe together? And I want to make it very clear tonight. I am with AARP, and yes, we generally represent 50 and older, But I also want to make it very clear that caregiving is one of the #1 priorities for ARP Nebraska, which includes, we know, caregivers of all ages, as well as those that are being cared for at all ages also. And so as a priority, intergenerational care and younger care across the lifespan is very important. So keep that in mind as we talk tonight. Most of my comments, again, will be very general and they're not age related. But I just always want to make that disclosure because some people scratch their head and say, well, this is just for people that are older, and no, it is not. So just keep that in mind as we're talking along tonight. I also want to shout out and say Happy Veterans Day to all the veterans out there, or any family members that are veterans, or if you're caring for a veteran. Thank you all for your service, your sacrifices, and for, again, the unwavering work that you've kept to do in keeping our country safe. So I do appreciate that very much. So moving on, again, I have several slides. If you do have questions, certainly feel free to put those in the chat at any point in time, or the Q&A, and you can stop me along the way. I'll let Jennifer and Chrissy kind of watch that. If there's something we need to talk about in that immediate slide, feel free to let me know that as well. But we'll just go ahead and jump in here. So the first slide I want to start, because I think everyone probably knows, but November is National Family Caregiver Month. And it's, again, a very important month, but that's not to say the rest of the year isn't also important. And so I put this up here. We, members of the Caregiver Coalition, actually had a proclamation ceremony with Governor Jim Pillen actually last week at the state capitol to recognize caregivers of all ages and all kinds. And to proclaim the month and recognize, again, the importance of caregivers. And so we from ARP want to salute anyone that's around the table tonight as a family caregiver. Also keeping in mind that it's a year-round position, 24/7, and it's not just one month of the year. So keeping that in mind. The first several slides that I have, a lot of you are going to be like shaking your head and saying, yeah, we know this because we are caregivers. But I always like to kind of start my presentations with a little bit of like what we call the backstory to build up to where we're at with the caregiver tax credit. So I'll run through a few slides and then we'll dive deeply into the caregiver tax credit itself. We do know family caregivers, you fill an essential role and are often seen as the backbone of our long-term care and home and community-based services systems. We know you're a key emotional and companionship support for care recipients. And again, the key to aging in place, no matter what the age or the disability is by having a caregiver that allow that to happen. When we survey Nebraskans of all ages, 90% of people, and I don't think this is surprising, but 90% of Nebraskans say they want to age in place at the lowest level of care possible, regardless of their age. And again, the only way that that's able to be done oftentimes is with the help of a caregiver. We feel that caregiving is an essential public health service and should be prioritized as an emerging public health issue. And recognizing and, again, supporting family caregivers is crucial to not only health and economic, but also social well-being of both the caregivers and the people who provide the care. This quote, this next slide, I'm sure everyone's heard of Rosalind Carter or knows who she is. I always just start this because I think this is an important quote, and it really is something that we all need to think about. There are only 4 kinds of people in the world: those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregivers. We know that more than 2/3 of the US population will likely need help with tasks at some point in their lifetime. And the other is caregiving it affects everyone. It does not discriminate based on age, race, religion, location, education, and so forth. It is a nonpartisan issue. The next slide, family caregivers, again, as I said earlier, are the invaluable backbone of our long-term supports and services system, as well as our home and community-based care system. And we know that we depend on caregivers to provide that care to their loved ones, again, to stay at the lowest level of care as possible. Some of the key prominent issues in caregiving currently, and as we look to the future, really involve 3 key areas. And one is the balancing act of the sandwich generation caregivers. Many of you probably are doing that right now, knowing how that works. We also know the impacts of caregiving on employment for working caregivers. Some of you are having to not work full-time or step aside from a working profession because of the demands of the caregiving that's required. And then the last one is the impact of the direct care workforce shortage on family caregivers, as well as care recipients. Sorry, my thing is, there we go. ARP does a caregiving report every year or every couple of years, specifically does research on caregiving. In July, we released a caregiving in the US research report. If you're interested in that, you can either Google it or I can send it as an attachment. But this was done in partnership with the National Alliance for Caregiving. And we know from that study in July, overall nationally, that 1 in 4 Americans, or 63 million people, consider themselves a family caregiver. This was a 45% increase since 2015. I looked at that over the span of 10 years. We also know that 59 million people nationwide are caring for an adult 18 and over, while 4 million people are caring for a child under 18 that has an illness or disability. In Nebraska specifically, we know there are 312,000 unpaid family caregivers, and this is for caregivers that are providing care for all ages across the lifespan. And the care that they're providing is over 168 million hours, and that's again unpaid care, not compensated. And over 2.8 billion is what the value of that unpaid care is. So you look at the economic driver that caregivers are, that you are, and what you're putting back into the economy. It's vitally important, but it's also important for the state to understand and realize that, because of the savings that you're providing to the state as well. Biggest challenges for family caregivers, again, the time and money and financial are the top two that comes across. Again, I don't think that's probably surprising to anyone, but when nearly 1 in 4 caregivers provides 40 hours of care or more per week, we know that 8 in 10 family caregivers, or around 78%, also incur out-of-pocket caregiving costs out of your own pocket. And one of the staggering other facts that I'll throw at you is studies estimate that the economic cost of foregone earnings by family caregivers of older adults in 2023 was $67 billion. It's really what that is, again, that's the earnings that have been set aside for people who are no longer able to continue to work full time, bypassing $67 billion nationwide. The other one I'll mention is social isolation and loneliness. And again, I think this really came out with the pandemic. We really started to understand how important social isolation and loneliness really was, and how evident it was, regardless of the age. It has huge effects on mortality for people, again, regardless of what your age is. But again, one of the biggest facts to think about is lacking social connection. It can increase your risk for premature death, and it's compared to as much as smoking 15 cigarettes per day. So it's, again, important to realize, we can't become socially isolated. We can't become lonely. We have to find networks and outlets. Things like you're doing tonight, I think resources, as well as support groups, is also important things to keep in mind. The other big message there is, if you don't take care of yourself, there's no way you can care for your loved one. So keeping that in mind as well. Access to resources and lack of formal training, I'll mention that very briefly. And I bring this up just because I think we all know we do have a lack of workforce. We have a lack of resources as far as respite care or respite providers. We also have a lack of the ability for nursing staff, medical staff, and even just, again, that home health direct care workforce staff that we have, which in turn then creates problems when you're not able to find someone to provide that respite or to do it in the capacity that's needed. And then the other is a lack of formal training. And this is a big priority for ARP, is working with the medical community and making sure when people are discharging from the hospital or discharging to a lower level of care after they've had a care episode, that medical staff is providing that proper training, because we know if we're sending people home and they don't have the proper formal training, the likelihood of a relapse or ending back in the ER is very prominent. So with all of that and all the facts behind that is kind of, again, as I said, ARP has taken caregiving as our #1 priority, and we've been doing this for several years, and kind of been chopping away at different things that we can do to help provide support to family caregivers. The thing I'm going to talk about tonight with the caregiver tax credit is one of the financial pieces of the puzzle, financial support. And I do want to make it very clear, obviously, there's many more things that need to be done, and we'll continue to work on that. But this is just one very small piece of the puzzle. And so in this picture, you'll see Elliot Bostar, Senator Elliot Bostar, Legislative District 29. He is actually the one that carried the bill 937 and brought it across the finish line in the legislature in 2024. Again, LB 937 allows those of you that are family caregivers, if you incur expenses out of your own pocket, they're not reimbursed by anything else, you can get a non-refundable tax credit up to $3,000 off your taxes every year. The other, again, you'll see the big bright red regardless of age. So again, this is very key to remember. It does not matter what the age group is of the person that you're providing care. If you meet the qualifications and you can provide the receipts and such, you would qualify. So the caregiver tax credit, again, we passed it in 2024. It became effective at the beginning of this year. Obviously, you will not file for it until next year in 2026 when you're filing for your 2025 taxes. But it is important to know, if you're not aware of this and you do qualify, we encourage you to start doing the work now and start doing the filings. So you're not bombarded at the end of the year trying to do it before you submit your taxes the first of next year. So it's, again, started of January 1st. The Department of Revenue got the website up and going in February, and they are now taking applications freely. It is a non-refundable tax credit, and again, that's important to know. The difference between non-refundable and refundable, if it's a refundable tax credit, they're going to cut you a check and they're going to send back money back to your account. Whereas non-refundable means you have to be paying into taxes, and they will take that off to the top of the taxes before what's owed comes due at the bottom. So non-refundable. Again, the credit is either $2,000 or $3,000 and up to that amount. Again, we have up to $2,000 for those that are providing general caregiving, and then up to $3,000 if you're caring for someone that has a dementia diagnosis or is actually a veteran. And those kind of came, we actually modeled our legislation off of Oklahoma's legislation that passed the year before ours. And so, again, it's up to those two amounts. Again, those with dementia and veterans benefits oftentimes need more care and more out of pocket, which is the reason for the $3,000. Again, no age restrictions. And then the other important key point to think about and know is there are some income guidelines. And again, these are adjusted gross income. So this is whatever you're reporting to the IRS on your taxes, on your 1040N. I think it's line 9, I believe, is what you will use to pull off of your taxes that goes into this form. Income guidelines, again, you could be making no more than $50,000 as a single person or no more than $100,000 as a married couple. Again, this is a number when we've been out talking to people. I guess I want to make sure everyone we had to start somewhere. We have heard from a lot of couples or a lot of family members that this is too low. Many people are making more money than that. But if anyone's familiar with how the legislature works, oftentimes it's making sausage. And so you have to compromise and find a starting point. Our intention is at some point to look at these numbers again and potentially open it back up and actually increase the 50,000 or the 100,000 to higher levels, you know, again, based on what's going on in the economy and that sort of thing. So more to come on that, but that's where we sit right now today to test things out. And then we'll, of course, revisit that as we go along. So who is eligible, or what's an eligible family member considered? Again, you must, and this comes directly out of the Nebraska state statute. We just took the definition and actually put it back into the language of the bill. And just otherwise, again, when you start trying to change language like that, it gets ugly. So pulled it directly out of the statute. An eligible family member must qualify as either a dependent, a spouse, parent, or other relation by blood or marriage to the family caregiver. So that's your first qualification. The next one is you must live in a private residence. And this is really important for people to know. The whole point, again, is supporting caregivers and aging in place and keeping people in their homes. And so one of the provisions is this would not include anyone that lives in an assisted living, long-term care, nursing facility, or any type of residential care home. Again, if you're in one of those facilities, we have had people ask, well, if I'm paying my loved one's assisted living rent or monthly bill, does that count? And no, it does not. Again, they have to be living in a home type of environment. Again, I will also remind people that being the caregiver doesn't necessarily mean they have to live with you. If you're providing some kind of financial support outside of your own pocket and not providing that caregiving directly to the caregiver, maybe we've had people that are purchasing home health services and paying for that from another state type of thing, that would qualify. There is a certification process that's required, and I will show you that form here in a few slides. I will also encourage, my contact information is up here. You can contact me at any time. We do have actually packets of the information that if it would be helpful, I'd be more than happy to send that out to anyone. I can mail it, or we can also provide it to Jennifer and Chrissy to post it, also for pieces of that if people would like to pull that off. So the forms themselves, and we'll talk about this, are all were all generated by the Department of Revenue, and they created it all. It's their website. So that's what we're using as we move forward. The certification process is really important, though, because you have to have this piece of document in order to qualify. Even if you make all the other pieces and qualifications, you also have to have that certification. And part of the reasoning for that was really the legislature wanted to make sure that no one was taking advantage of the system, but had that checks and balance in play between the caregiver and the healthcare provider, that they would definitely say, yes, so-and-so is providing care to this person, and marking whatever the boxes might be for that qualification. So the form is called 3165C. The other piece that the healthcare provider will be required to acknowledge and sign off on is that you are providing a care to the loved one or the person for at least 2 activities of daily living. There was talk of making it 3, but we were able to keep it at least at 2. You only have to meet 2 of those ADLs in order for that to qualify. Most of you probably are aware an ADL, of course, is ambulating. They need help with dressing, feeding, personal hygiene, continence, and that sort of thing. So again, I'll show you what that form looks like here in a couple of slides once we kind of get through the qualifications piece.
Gina, we've had a couple of questions come in. If that's okay. Did you want to stop and take them, or would you like to wait till the end?
No, that's fine. Go ahead.
Okay. This one refers to must the individual qualify as a dependent per the IRS guidelines, or marriage or blood relation only?
Okay, so can you say that one? I'm trying to follow the.
Sure. So you have if you go back one slide, it had the eligibility, and the question was for an eligible family member, must they qualify as a dependent per the IRS guidelines, or is it by marriage or blood relation only?
It would be by the IRS guidelines because of how that you're reporting it through the tax system. Yes.
Okay. And then the next question is, will there be data collected on how many families claim the tax credit after 2026? As stated, the income restrictions are too low, and it's discouraging for families who don't qualify. We're saving the state a lot of money doing what we do. The statistics would be interesting to see how many families exceed that income amount.
That person, whoever asked that question, is spot on. And yes, there is a tracking, and I'll show it. Actually has that is one of the slides towards the end. The Department of Revenue, it does have a page that is tracking how many people have applied, and then how many they've actually are potentially planning to award. There are caps on this funding, and I'll also talk about that here shortly. But I will tell you from what and again, the tracking and the updating of that system hasn't been real timely. But every quarter they've technically been updating that. But we are finding, yes, that there's a lot of people that potentially would qualify if the income guidelines were higher. I'm being very transparent and honest with everyone on that. And we're definitely taking note of that. And I very much appreciate the comments about saving the state money, because that is 110% correct. And again, I just want to remind everybody, it's a starting point. It was a compromise. Nebraska was actually the #1 state, or the only state in the nation, that had the most comprehensive tax credit. Oklahoma passed one before we did, but theirs was restricted to, you had to be taking care of someone that was 62 and older. And so when we brought Nebraska's bill, we said, no, we're not doing that. We need to open this up to all caregivers. And so again, I will use the sausage making accurate, or the example is, we have to start somewhere, and so this is what we were able to start with. But we hear you loud and clear, and we very much are taking all of that in, and have been having conversations with Senator Bostar about reopening it and expanding the income guidelines. So I do appreciate that comment. I think it's fair and it's spot on. I'll show you the slide at the end where they're showing the tracking, and you can go out anytime and look at the website. It's not updated daily. It's, like I said, probably quarterly. But I will also tell you utilization right now is not what we would like it to be or what we expected it to be. And again, I think there's several factors in why that is. So I thank you for the comment, and I totally get it. I agree wholeheartedly. So we will be continuing to work on this.
Okay, we've had a couple more questions come in. Just would a person be eligible for this ×2 if caring for 2 people with qualified disabilities?
Yep, another great question. And yes, there, as long as you have independent receipts for each individual, you can receive the credit more than once. It is not $2,000 for everyone in your household. It is actually per whoever you're taking care of. So, and we have had that actually asked several times, that there are parents providing care to multiple children in the home who have disabilities independently and have their own independent needs. So yes, you can qualify and file those separately for each child. And the way you'll do that, again, I'll show you the application, but it's based on Social Security number. And so each person will have their own application that you'll have to fill out. So good, another good question.
Okay, another as far as eligibility. I am my son's guardian. Would I be able to use this tax credit as he receives SSI and uses this for his care?
Yep. The main thing to remember is these have to be out of pocket costs. So it can't be, so if you're not getting any sort of reimbursement for the care separately, then it would count. So if you are paying out of your pocket and paying for the care that's being provided independently, and you're not receiving any reimbursement back from insurance or Medicaid or whatever that might be, that would be included. I think to clarify, if I'm not mistaken, the question, the person is saying that the Social Security or the SSI income is what's being used to pay for his care. In that case, it would not qualify because it's his income individually versus it would have to be the parent. If there's any income that or anything in your own pocket that you're really reaching into to provide that or supplement that whatever's over the top, that extra would actually be what would qualify under the tax credit.
Thank you.
Yep, great questions, everyone, and thanks for the questions, and keep them coming. So now we're just going to talk the next slides about, again, what are some things that would count as qualifying for the care, or what items can you claim based on, you know, what's written in the law and that sort of thing. So the first one is the eligible expenses would improve anything that you're improving or altering your primary residence for the family member or the eligible family member. And again, these are anything that you're doing that permits and allows the person that you're providing care to remain in their home. It has to kind of have to be tied to that. So without this person wouldn't be able to remain in the home. So examples of that is I've listed a whole list here. Again, this is not exhaustive, but it's some of the bigger things that we're seeing and hearing. Specifically, you know, wheelchair ramps. I know some people are able to get some assistance in building those, but those that are not and paying out of pocket, it can be very expensive. That's one big example. And then we have things like grab bars and handrails, which don't really cost as much, but it's still an out-of-pocket expense that could still be added into that. The other is, you know, zero threshold entryways. Some of our older homes, if you have someone who wasn't wheelchair bound and came home from after a medical event and you needed to widen your doorways, that would be an example. Those kind of costs would be covered. Relocating light switches or sensor activated lights. Those are some new things we're starting to see, especially for people in wheelchairs as they move the light switches down. Obviously, if you're in a wheelchair, your arm doesn't reach as high. And so you're able to, you know, have the access to that at a lower level. Stair lifts is another big one. Again, sometimes people are able to get some help through programs, but other times they don't. And so, you know, maybe if you're getting help for paying for that, but the out-of-pocket deductible or something like that is out of your pocket, that is an example of something that could be used and reported for that expense. Other expenses that are included would be purchasing or leasing of equipment. So these are more of your hands-on things that the person that's being cared for is actually utilizing that, again, provides them some kind of freedom and independence, but while also creating a safe environment for them. Again, examples of that would be lift chairs, electric wheelchairs, medical alert systems. We're starting to see a lot more smart home technology systems, again, with telehealth or telemedicine, or just hooking up where people are checking in with something that's automated. We've had actually some people have used Alexa. If you have a subscription to Alexa, those kind of things on a monthly basis, as long as you can tie it back somehow and justify it, that's what's, that check-in with Alexa with someone that needs care, you can tie that back. And then again, simple things like an elevated toilet seat, your shower chairs, walkers, braces, any kind of adaptive equipment would also qualify under there. Again, these are not exhaustive lists, so keep that in mind. I always tell people, if you aren't sure, call me and I'd be happy to inquire at the Department of Revenue for you. I had a person call me last week and wanted to know, they have a loved one who has a bed bug infestation problem, and home health can no longer come into the home. And so they wanted to know if they paid for someone to come and get rid of the bed bugs, if that would qualify as an expense. Unfortunately, we weren't able to justify it, but it's just an example. If you get into a situation, and I would be more than happy to advocate and asking the department on your behalf if that would be helpful. The last other expenses that are incurred, and again, these are your hands-on. So home health aides, respite care, adult daycare, child care, personal care attendants, healthcare equipment, technology. Again, think outside the box. If there's anything that you're using that is allowing you some respite or the freedom for the person you're caring for to remain in the home and again, be safe and independent as possible, think about those kinds of things. The main thing is just always keep your receipts. That way, if there is any question, you can justify that back to the department if they would ask for that. The next, the last slide here that talks about qualifications. And again, these are things that are not included. And, again, just keep in mind general household maintenance activities. So if you're re-roofing your house or you're repainting it, or you want to do electrical repairs, those are things that the department will not qualify, and you will not be able to use those. So again, it has to be that direct tie back to the person that is being provided the care. The other I've added here in my recent presentations, mileage, gas, and vehicle expenses. This is another area that we have on our list. We hear, especially from a lot of people in rural parts of the state who are having to travel for medical appointments or whatever that might be. Mileage is a huge factor. Gas is expensive. Transportation is expensive. People are having to take off work, and just the vehicle expenses in general. So right now, those are not included because they were not written specifically in the statute. And I mean, that's how picky the Department of Revenue has been on looking at these kinds of things. So this is another area. We are looking to open that back up when we look at those income guidelines, but also adding in things like mileage and transportation costs. So I would encourage you, if you do have any stories to share or specific examples that you could share with us. I mean, those are always helpful when we go back to try and expand on something that we currently have. So keeping that in mind.
So Gina, sorry, we had a question come up about eligible expenses. Would that include cameras or a security system if that was needed?
I cannot say for sure, but I would definitely say that would be something to definitely consider and put it on there. One thing I would encourage people to think about and doing, if that is a situation, you may want to go to your healthcare provider and ask for some type of note. I'm not saying that will make it 100% and get it across the finish line, but do go talk to your healthcare provider and ask for them to, this was maybe a prescription per se, and that this is something the healthcare provider said that, the person that was being provided care needed. That's, I don't 100% have the answer on that, but I'm happy to take that question to the Department of Revenue. Again, if someone can email that to me, again, I will leave your name out and all that, but I would be happy to forward it, and then I can get back to Jennifer too if the group is interested in that answer. But I would say it's not off the list. And so again, if you can somehow tie it back, I think that's something to think about. So let me know. I'd be happy to help you with that.
We had one more. What about
Okay.
a wheelchair van? If the person was using it to access the community?
Yep. Again, the only thing I just remind everyone, the expense has to be somehow you have to show that it came out of your own pocketbook and it wasn't reimbursed by any other program or service. If it is an independent expense that you are paying out of your own pocketbook, writing the check or whatever, then yes, it would qualify. Definitely. Great question. So moving on, the other piece of this that's key to remember and think about is that the eligible expenses is 50% of the eligible out-of-pocket expenses that are incurred during that taxable year by the family caregiver is what would be in reimbursed. So my example up here is if you want to get the full $2,000, you would have to submit receipts that show $4,000. Again, this is not something I liked, but again, it's one of those sausage making. We had to do some compromising, and so it's a starting point. So again, if you're caring for someone with dementia or has a veteran status and you want the full $6,000, you have to submit that $3,000 out of pocket in order to get that. The other thing I want to remind people is you don't have to submit the full amount. We have some people like, well, I'm not going to spend $2,000 or $4,000. It doesn't matter. If you only spend $500, please submit it because you're going to get $250 back off your taxes. So keep that in mind that these are just the 2,000 and the 3,000 are the magical numbers of what the maximum is. But there's not to say that, if your expenses are a little bit lower, you still need to apply for it and get that back on your taxes. Any unused credit cannot be carried over. So if you don't use the full 2,000 in 2025, you can't carry over the remainder of that into 2026. It will start over every taxable year with a new set of 2,000 or 3,000 if that's what you're earning. One question we've been posed a lot, and this is a little bit different than if you have two people in the home that are being provided care. This is if you have two people on the outside that are maybe sharing the expenses. Sometimes we see siblings are helping pay for care for a parent, and they're splitting the costs. So you have two entities that are paying outside on their own. They can split the cost of that and they both can receive reimbursement. But the thing is, it will only be up to that $2,000. So if they spend $4,000 and they both submit, again, it's $2,000 back for each of them, or excuse me, it's half of that for each of them individually. It wouldn't be an additional $2,000 for each person because it's the one person provided care. You can only claim if you are a Nebraska resident. We've gotten this question quite a bit, is if you live in Nebraska, but your loved one is in another state and you're writing a check for them, that would actually qualify because you are the person that's living in the state and your money is being spent on caregiving. If that's the case, you would be able to do that. We also have had people ask, their loved one lives in another state, but mom or someone lives in Nebraska. If that's the case, that would not qualify because you, again, have to be a Nebraska resident that's paying taxes. So that's kind of the differentiation that's important to remember. Limitations, and this is where we were talking about what the cap is. When we started this bill and legislatively, we did not have a cap on anything. We just kind of went forward to see what the revenue department was looking at or what they thought we could come up with. And so we were able to get 1.5 million for the first 2 years of the program and capped it at that. And then that third year, it would actually go to 2.5 million thereafter. So it doesn't seem like a lot of, or it seems like a lot of money, but it's really not. If you take that 312 family caregiver number that I talked to you about earlier today, and you divide that out into the 1.5 million, if everyone claimed that even $2,000, it would not go very far. But again, what we're finding is, again, unfortunately, there are some people who are not qualifying based on some of the things we talked about. The other is people are just not aware of it, which is why we're talking about this tonight. But again, the last I checked, we weren't even close to capping this amount of money. So the fear we have is if people don't utilize it, and you've all heard the phrase, if you don't use it, you lose it. That's our concern also going into the fiscal debacle that we have right now with our general funds and our budget in general. We promise to do whatever we can to, protect this fund. And I know Senator Bostar is in that same boat. But when we start looking at having deficits in the budget, they start looking at making some of those cuts. So if you think you're eligible, I really highly encourage people to go ahead and to definitely apply for it and go through the process of that. The other thing I'll talk about real quick, and then we'll kind of go into what the forms look like, is we're also, if you qualify or you think you qualify, we're asking and telling people it's probably a good idea to start filing those on a monthly basis instead of waiting till the end of the year if you have a stack of receipts and trying to do it all at once. And again, we have helped several people through our work that we do in filing those every month. Again, we'll walk through what the online process looks like. It's what, once you figure out how to do the application and upload the receipts, it's actually not very difficult to do in that aspect. So again, it opened up February is when they started accepting applications and when you could start filing those. And so it will now run through the end of the year for the 2025 filing system. As I said, the Nebraska Department of Revenue is the regulatory oversight. We call it the NDOR. All applications, again, have to be submitted through them directly with the proper forms, which will show you both of those. And then also uploading or providing the receipts to document or support whatever you're claiming for those expenses. It's important also to know that these are approved in the order they're received. And right now that flow isn't overly large, again, from what I was talking about, but if it ever got to the point where they were starting to get to the cap, again, you would be approved in the order they were submitted through the department's system. So again, another reason, if you think you qualify, we would just invite people to start doing this now. And then continue to do it if you have expenses every month, to continue to do that and upload those on a monthly basis. And then again, keep records of your forms and that sort of thing. Documentation, again, required eligible expenditures. Again, if you have anything you're purchasing, if it's a service, get a receipt. Make sure, there's the proper documentation on the receipt, what it was for, the person that they're providing the care for, the hours, the amount that was paid. That sort of thing. The ADL certification, again, through the healthcare provider, that 3165C is also required. And then any other documentation that the department might ask, again, once you've submitted everything, they may make a follow-up call and just ask for clarification on something, or if they need something additional on that. The 3165C, I'll also mention to everyone and let you know, is once you've uploaded that once, you will not have to put that in your documentation every time because you've got that for the year. You will have to get a new form every year, every tax year. That's a recertification by your healthcare provider. So my advice is, either keep it electronically and use the same form or make copies of it if you're going to submit things hard copy so you don't have to get a new one every time. But you want to hang on to that original 3165C form from the provider. So you have that.
We had a question come in, Gina. Is this going to be something where you fill out all of the information through your tax software, such as TurboTax, and it tells you at the end if you can claim it or not?
Good question. And I'd love to say yes, but no. Again, this is separate. You will have to do it all through the Department of Revenue, which in a couple of slides, I'm going to kind of show you what that looks like and where to go to receive that. And what you'll need, again, once you start filing the taxes, if you have a tax preparer, there will be a line on your taxes that you can claim it on there and enter it there, which then the department will match that up with what their records and systems say. But unfortunately, they will not be on the form. You'll have to go through the process and get the approval before you can actually put it on your tax form.
Okay, and does this go if you use a CPA to file on behalf of your family? Can they provide everything?
They could, and I would encourage and make sure your CPA knows about it. I know the Department of Revenue always sends out updates, but I also know there were tons of tax credits that were passed in the last couple of years, and so most of them should be familiar, but it will not hurt for you to inquire with them about it. And it certainly, I don't know if they'll charge you a fee to help you fill it out. They might, because of it's another piece that they have to upload to the department, but they can do it for you on your behalf. The other, I would say, I will put it out there. If you need help doing this, I will not charge you. I'd be more than happy to try and at least try and help you walk through the process to file it. It's once you figure out what you're doing, it's not as difficult. I wouldn't say, you know, it's not smooth because the systems we're working with the department are fairly old. But you know that it's doable and it's pretty easy once you figure out what you're doing. So again, I would be more than happy if there's someone that's needing some help or assistance with that. I'd be more than happy to offer that as well. So this slide just kind of shows you, again, when we passed this legislation, we knew we needed to get the word out. We needed to have some kind of a system of doing that. So we actually created a specific page. You'll see the website up here. And then there's also, once you get to the website, there's different things for resources that are available for people. You can scan the QR code to get to the website. We also have a tax credit receipt folder. And that's what I was kind of talking about. If you're interested in extra or hand copies of anything that you might find on there or that we're talking about tonight, I have those available, again, free of charge. We would be happy to mail this out to anyone. You just need to get in touch with me. We have a trifold brochure. We have an FAQ. We also did some YouTube videos where we walk through how to actually, when you get to the website, how to go through and fill out the forms and that sort of thing. It's a series of 5 that you can watch those. You can pause them and listen and get the help that way. The other is another thing that we created was an eligibility tool. If you're not really sure if you qualify, you can go to this website. It's just a Google form. You can click on it and go through a series of, I think it's 5 or 6 questions that they'll ask you. And based on what you answer, it'll say, you know, based on your answers, you may or may not qualify. It'll kind of tell you based on what your answers are. And then for more information, and it'll again link you then to the Department of Revenue's website. So again, we just tried to find a way that was a one-stop shop to, and again, this is for anybody. It doesn't matter if you're an AARP member. It doesn't matter if you're 50 and older. It's for anyone. The caregiver tax credit is for anyone that's a caregiver. So I would encourage you, if you would like to go out and peruse that, you can do that. You can go to the website, or again, you can scan the QR code. Again, the website's right here, or again, if you want to scan using your smartphone with your camera, it'll take you directly to the website also. So the next few slides again, and I'll kind of walk through these fairly quickly in the sense of, you know, a lot of this is fairly self-explanatory, but what I've done is taken some screenshots from the department's website to help you at least figure out how to get to it, and then what it looks like, what those forms will look like, and that sort of thing. So this is the website you would go to on the Department of Revenue. If you don't want to type it in, you also can Google Nebraska Department of Revenue tax credits, and it'll take you to the tax credit page, which is shown up here. Again, in the red circle, I have the caregiver tax credit. You will directly click on that first. This next slide, by no means do I expect anyone to be able to read this. It's just a screenshot of what it looks like. Again, it's a background on the legislation. It's a background on what the qualifications are. Basically, what they've done is taken the legislative bill and kind of transposed it and put it on the screen in one page. What's going to be of more interest to you is when you look at this next slide, is when you get to the bottom. This is where you're going to find all of your forms and uploading and whatever else you might need. You also have contact information. Mary Kate Kincaid is the Department of Revenue contact. I do encourage anyone, if you have questions, to email and reach out to her. At first we weren't getting a lot of response, but she's actually been pretty responsive if we have questions now. Or again, if you want the middleman, I'd be happy to advocate on your behalf to do that also. So the tax credit application forms and the 3165, those are the 2 areas you're going to want to look at first. And what you see up here is a screenshot of what that form looks like, 3165. So this is the actual application. So when you bring it up, it is a typable form. You can type into the PDF, and then you can save it. The only thing to keep in mind here is you do have to have an actual signature on this. So you would still need to print it off and figure out a way to, you know, take a picture of it and save it that way, or upload it through a scan to your email in a PDF document. I will call to your attention when we talked about the federal gross income, the AGI. It's under the Part 1 section, again, Form 1040N, and it's line 5. That's where you'll pull off what you're reporting as your income to make on the qualification. So again, this is things to think about. These aren't all your assets as far as your home. And again, this is all just the income you're reporting and actually paying taxes on to the state. So that's one thing I want you to keep in mind is that's what determines what the income guidelines are. And again, comes directly off of what you're filing on your taxes. The eligible family member, again, this is the person, again, that you're providing care to. You'll fill in that information. You will see the Social Security numbers identified. And again, that's where they're going to do up the matching in their records with the IRS and also their state systems to verify that it is a real person. There will be a lot of those kinds of things that's going on. The Part 2 under the eligible family member also is your family member a veteran, and again, that's where it's gonna trigger to know whether or not it's that 3,000. Are they diagnosed with dementia? That's the second box of that 3,000. But then, what's your relationship? And again, this is where you're going to check how you're related to the person you're providing care to, and then they will go from there. The next part is the eligible expenditures. Again, this form, you can type it in or you can write it in. One thing I've been helping people that are actually mailing it in is take this form and fill out parts 1 and 2, and then leave 3 open, because if you make copies of that, you won't have to keep filling out parts 1 and 2. You can just take the form and start filling out 3 and then sign it and uploading it that way every time you do that. So again, type of expenditure, vendor name, again, who did you pay the money to, description of what that expenditure was, when this took place, and then the amount. Then you'll total it up. And if you look at the top of the page, then part 4 is the credit computation. So you have to do a little math, but again, you're going to add up those columns. And then that's what you're going to submit to the department. You will sign it and send it to them. And then at the bottom, you'll see, again, this is where they'll review things in their system. Again, if they have questions on what you're submitting for an expense, they will call you. Or they'll email you. If you provide an email, that will be their first type of communication. If not, then they will definitely make a phone call to you. And I have had a couple people, they've called just for clarification of exactly what the expense was. And they just needed the clarification to move it through. 3165, again, this is the form that you need from your healthcare provider. Again, you only need to do this once. So for the whole year, you only need the form once. Again, you don't have to upload this every time because they already have it in their system. You also don't have to get it refilled every month, and re-signed. It's good for the whole year. You will need a new one with the next tax year, but for the time being, this will work. You'll see again, the eligible family member and the ADLs. There has to be 2 of those that are checked by the healthcare provider to, again, verify that you indeed do qualify based on that. Again, they sign it, and then you have to sign it, and again, you'll upload it from there. So the next slides, and again, I'll run through these quickly. I know we're at 7:24, and I want to be respectful of people's time. But again, the next button you'll see, going back to that original front page, is the upload form. If you want to do everything electronically, this is where you're going to click on that blue button. And from there, it'll take you to, this is their system. You'll put in an email, you'll put in your first name and your last name. We still haven't quite figured out what company means, but it's part of their system that they already have for tax filing. So you don't need to fill anything in under the company, and you can click Remember Me. Again, you're going to create what we call an account. And so every time you come back to this, you'll put that information in, and it should bring back up your information. And then you'll, again, upload your documents every time. So once you've created your account, uploading the page, and these are all credit to the Department of Revenue. I pretty much just borrowed their slides. Again, if you're familiar with drag and drop, you can do it that way. Again, depending on if you have double screens or what your capacity. The other is you can do browse files, which most people are probably more familiar with, where you're going to get a file from your computer and you're going to upload it there. Again, your application forms, your 3165C, as well as any receipts that you have. If you have them electronically, you can save a file that way. Or the other thing we've been encouraging people is just take pictures of your receipts and then save them to a file on your computer where you can upload them all every month into that and then submit them from there. Again, these are just the upload steps. Again, this is when you're trying to browse your computer and find the file and then upload it. Again, these slides will be provided to everyone if they have access to this after the presentation. Again, you'll see up in the corner, once you've uploaded them, there will be a green uploaded button that will come up that'll show you that they've been successfully uploaded, so you know that they have received those. And then once you're done with it, every time you submit your application, there will be a notification that comes in your email from the Department of Revenue that confirms that you did submit everything and that they'll be under review and be in contact with you. So for the person that was asking the question about showing how much is in the fund, this is what we call the tax credit authorization table. And just for reference, I'll go back here. You will find that on that front page where under the instructions to upload forms, that's where you can find that and check that. This slide, of course, was put in when they first started February 5th. Again, I checked, I think it was last month, and the number was very low, which again is a little bit concerning to us, even though we know the reasons behind some of people not qualifying, but we would like to see that number higher. So again, if you're interested, you can go out and look at that also and check on that. The amount requested is how many people have submitted the application, and then the amount reserved would be how many people have been approved. So again, just because you requested it doesn't mean the money's reserved for you. Again, you have to qualify and meet all the guidelines. So with that, resource pages, when you get this, these are all linked. Again, I just kind of thrown a whole bunch up here. If most of you are probably familiar with a lot of these, but I just wanted to give you some ideas. 2 full pages of those, things to think about if you're not familiar with that, or maybe you'll stumble across another support system that way. Oops. So in closing, I know we've already taken some questions, but if there's any more questions here at the end, my contact information, again, my email and my phone number to my desk. If I don't answer you right away, I promise I'll get back to you. I get back to every person, and I'd be more than happy to try and help or do whatever I can to provide assistance to anyone. But before I close and again offer any other questions, I love Tia Walker. I don't know if anyone knows Tia Walker. She's been a caregiver, but she's also an author. And I close with this quote: "Caregiving often calls us to lean into love we didn't know was possible." And I think especially for all of you that are caregivers, I just want you to remember how valued you are and how important you are. And sometimes as alone as you feel, just remember there are people that are supporting you. And again, don't feel that you can't ever ask for help. So with that, I'll turn it back to you, Jennifer, and I'd be happy to answer any questions that anyone has.
All right, great. We did have a couple more come in. So multiple people would need a form for each person. Is that correct? If there was more than one person caregiving for that individual?
Yes. So
Okay.
you can have, even if it's 3 or 4, again, the only thing to keep in mind is that the number won't change of the maximum of $2,000. So if there's 4 of you and you submit the 4,000, it would be split across, the 2,000 will be split across to all 4 of you, and equally if that's what the receipts are. If someone's got more expenses than the other, again, they're going to look at that, but they're going to match it up to the social security number of the person that you're providing the care to. So if there's mom is being provided care by, and 4 people submit it, they're going to have her social security number and match that to all 4 people. And then they will disperse the funds up to the $2,000 based on that.
Okay. And then if my wife and I both take care of our son and we married filing jointly, do we each need to complete our own separate 3165C?
No, because you're both, again, the qualification, if you're filing jointly, it's going to come off of your taxes together individually anyway. So no, I would say you could have the provider put both of you on there if you want to do it just for a safeguard. But no, that would not be required, that you both have individual forms.
Okay.
Good question.
aren't a lot of these expenses deductible already as medical on income taxes? Is this just a lower threshold versus the federal percentage and at a state versus federal level?
Some expenses may already be deductible, and I'm not an expert. So if anyone else wants to take that one, I'll admit I don't have expertise in that specific, that deep of in that. I know there are some expenses that are reimbursable or tax deductible, but there are others that are not. So I again encourage you, this is another step to try and provide some kind of relief to people who are providing caregiving. And so again, don't worry, the IRS, or excuse me, the Department of Revenue is going to make sure if it's something that's already being deducted that you can't deduct it twice. I again just say if you're in doubt, I would still file it, and don't leave anything on the table. And that's up to the Department of Revenue to figure that out, I guess is the way I would answer that. I'll also let you know at the federal level, we don't have a specific tax credit for caregivers, but that's also something we've been working on and trying to get across the finish line. There is legislation that's been introduced several times that would be similar to what we're doing here, but it would actually be up to $5,000 for caregivers. And again, this would come off your federal taxes. So what we're doing right now is only state, but we're also looking to expand that to when you file it, the federal taxes. That there would be an additional 5,000 that would come off of there.
Okay, that's all we have for questions. So thank you again, Gina, for joining us and providing this presentation and all this useful information. Again, like she said, she can reach out to Gina directly. Otherwise, Chrissy and I will be sending out a follow-up email with information on it. And thank you everyone for joining us. I am going to launch this poll really quickly before anybody else leaves us, just so we can get as much feedback